Ed Mustafa Jr. and his father, Ed Sr., are avid outdoorsmen who love hiking and hunting in the woods of New Hampshire. Both had bad knees that threatened to debilitate them. But then, together, they found an unusual doctor.
Good morning, hey.
Dr. Tom Hoerner is not only a superb surgeon, but he knows those he cares for as people, not just patients.
You just treat everybody as if they're important because they all are. If you look at these knees when we started, they were shaped like this.
Ed Jr. had grown up so bow-legged that eventually every activity was painful.
If I cut the grass on the weekend, I was done for the day. It was ice packs and elevation. I actually had to go into the woods, deer hunting with a cane.
His dad wasn't much better.
I got a little depressed because I couldn't do what I wanted to do. Couldn't hunt, couldn't climb any tree stand. I got angry. I got pissed at everybody.
We're going to go outside.
Mary Ann Loveday, a former Lexington schoolteacher, wanted to be able to keep up with her grandchildren, but her arthritic joints meant she could barely climb the stairs.
I did actually start off in a hospital in Boston. I started with 2 arthroscopic surgeries on my knee, and when I went back for another diagnosis, the doctor who I was seeing at the time simply told me that I had advanced arthritis and gave me some pills to take.
Hey, how are you?
Her experience with Dr. Hoerner was very different.
He's much more of an old-fashioned doctor, more like a country doctor. He's warm and caring and available.
Dr. Hoerner did a hip and knee replacement for Mary Ann.
I needed to know that it could be done and could be done successfully, and that I would have a different quality of life on the other side of this.
And you got it.
I absolutely did, yes.
Holy Family's Regional Center for Orthopedic Care has won many prestigious awards and is nationally recognized for distinction in knee and hip replacement and spine surgery. You're confident that a patient would do just as well here as any of the large teaching hospitals?
At least as well. You're lucky in some places if you ever see your surgeon post-surgically. We don't do that. I think it's, we're taking care of the patients ourselves, and when everybody puts the patients first, then you get an environment that really works well.
Dr. Hoerner says the goal is to allow patients to live their lives to the fullest.
So if you can't walk when you're in your 40s and 50s, why would you wait until your 70s and not be able to do things? Now you can really grab hold of these surgeries earlier in your life and live a better life when you know it matters.
What does it mean to you two to still be able to hunt together?
It's everything. It's my whole life.